Welcome to Hong Kong UMed. I'm very happy that you have now registered for our virtual Information Day. Hong Kong UMed is a very special place, and in choosing to become a part of us, you are already making a big leap forward to this commitment of becoming a healthcare professional. It is not easy to make this leap of commitment, especially during these extraordinary times. We have been under a tremendous amount of pressure since the middle of last year and throughout the ongoing COVID-19 pandemic, and indeed for the foreseeable 6 to 12 months ahead. And for you to have even considered, and therefore having joined us at this virtual symposium, I commend you and I congratulate you, because it takes a tremendous amount of wisdom, of dedication, of service to choose to be a part of us. Now, let me tell you why you have made the right choice. I think you have made the right choice because medical services, nursing care, pharmacy, Chinese medicine, and biomedical sciences and global health and development. These 6 areas are precisely the disciplines which Hong Kong still holds a very large edge compared to our neighbours. And indeed, Hong Kong UMed has remained in the top 3 institutions in all of Asia offering these programs. So I think that you have the foresight in order to make this commitment to health and healthcare, because you realize that in joining one of these disciplines, you will be still at the vanguard of health and healthcare in all of Asia, if not the whole world. These are the areas that Hong Kong still has an edge. These are the areas that Hong Kong U still ranks absolutely top. And by joining one of these 6 programs, you will become one of the family, the Hong Kong UMed family. This family has got such a rich legacy in that we're not only part of the oldest university and the most established and highly regarded in Hong Kong and all of Asia, but in fact, we even go further back and deeper than Hong Kong U itself. Hong Kong UMed preceded Hong Kong U by a full quarter of a century. And with that kind of legacy and rich heritage, and alumni ranging from Sun Yat-sen all the way to our newest graduates who have been at the vanguard in the front lines combating COVID-19 in our hospitals. I think that you know that we can stand you in very good stead as you embark on a lifelong career in health and the sciences. So I'm not going to take up any more of your time because we have such a rich program for you to explore. Please carefully consider each of them to see whether you might find a good match with your career aspirations and with what you are looking for in terms of campus life, in terms of the mentorship that we may be able to offer you, and most of all, in terms of your peers, people whom you will make lifelong friendships with and also enjoy very happy career moments all through the rest of your working life. So with that, thank you so much for considering Hong Kong UMed and our 6 undergraduate programs. Good luck and Godspeed as we all battle through the rest of the COVID-19 pandemic together.
Hong Kong U Med is the longest established institution of higher education in Hong Kong and is well known as a pioneer in medical education, training and research, while proudly upholding a reputation for morality, vision and care. The Times Higher Education World University Rankings has consistently ranked us one of the top in Asia in the category Clinical, Preclinical and Health. We admit about 580 students to our 6 full-time undergraduate programs each year. They are part of the contingent of about 2,900 undergraduate students studying in our faculty in any given year. We also count about 1,700 postgraduate students in our student body. Teaching is conducted by more than 400 full-time, highly qualified teaching staff who come from our 14 departments and 4 schools, alongside about 3,000 honorary teachers, most of whom are doctors and medical professionals in public hospitals or private practitioners. The excellence of the education we provide can be seen in our graduates, who have gone on to be leaders in their fields in Hong Kong and the world. Research is an important part of Hong Kong U Med's reputation, and we are always looking ahead to discovering the next breakthrough and improvement in people's lives. Our researchers are provided with funding, facilities and other support to explore new frontiers of knowledge and to collaborate with world-class scholars. We have a constant stream of activities for sharing ideas, embarking on new research and exchanging feedback. Hong Kong U Med also delivers superlative clinical service and provides robust clinical governance in all settings that we serve. The Hong Kong U Health System provides a one-stop service that integrates clinical staff and healthcare organizations with patients. Our 4 teaching hospitals offer valuable opportunities for students to learn more and learn better, and for the faculty to be a pioneering leader in healthcare management in Hong Kong and the region. Beyond the classroom, laboratory and clinical setting, Hong Kong U Med has been at the forefront in providing relief in crises and direction on medical and health policies. Our members actively share their expertise to the local community and engage with governments and international institutions to advance national and global health and medicine. Hong Kong U Med has well-equipped teaching spaces and research facilities at its Sa Soon Road campus. To provide more space to keep up with the growing demand for research and education, we have developed a comprehensive plan to transform Sa Soon Road into a contiguous state-of-the-science medical campus, which will enable us to upgrade the exceptional support and opportunities we offer to students even further, and incorporate new technologies that will advance our research to the next level. As a globally respected hub of excellence, our stature keeps rising as we strive hard to meet our ambitions to provide the best training and research around, and to share our know-how with the widest community possible.
Hello, my name is Professor Gilberto Leung. I'm a neurosurgeon by training. Within the faculty, I serve as the Associate Dean in Teaching and Learning, which means I'm responsible for all 6 of our undergraduate programs. All of our 6 undergraduate programs are concerned with health and healthcare. For those of you who are interested in practicing as physicians, we have, of course, our Bachelor of Medicine and Bachelor of Surgery program, which is of the longest history within our faculty. One of the outstanding features of our MBBS program is its problem-based learning approach to the teaching of basic medical sciences and also clinical sciences. With PBL, students are given the opportunities to explore clinically relevant issues. They can learn how doctors think, how they make diagnosis, how they decide on treatment, for example. More importantly, we would like our students to learn how to communicate with patients, how to understand their difficulties. In the last 2 years, our 3rd year medical students would have done the enrichment year program, which is the first of its kind in the world. During the enrichment year, students are able to do something that they are interested in, something of their own choice. Although it is a credit-bearing program, students are given a wide range of choices. For example, they can do research overseas, they can do humanitarian work locally or in other nearby countries, working with NGOs, or they can do intercalation with, for example, an overseas friends of ours and institutions in Europe or North America. One of the main purposes is to allow our students to gain a broader experience about the human condition. We would like them to see something outside the hospitals about how people actually live, how they struggle with life's problems. For some students who are interested in research, they can also do, for example, an integrated degree in Master of Research in Medicine. They can do Master of Public Health. They can even enroll in the PhD program. So much so that by the end of their MBBS, they would be able to obtain first the MBBS degree as well as a Master or even a PhD degree. Although our MBBS program has a very long history, it is by no means old. In the past 1 or 2 years, we have made a big effort in modernizing our MBBS program. For example, now all our Year 1 and Year 2 didactic teaching materials are all available online so that students can review and perform formative assessment online at their own leisure. During the COVID-19 pandemic, many people speak of the new normal. What our faculty believes is that we should aim at the new better. We should take advantage of this opportunity, take advantage of this challenge to develop something that our students would benefit from, something that the faculty would feel proud of, and something that would distinguish us from other medical schools. For example, in the future, all our teaching materials will be available online. Students will be able to view these lectures and review these lectures and to participate in online discussions and online quiz so that they can consolidate what they have learned and to confirm what they have learned. We believe that with this new platform and approach of e-learning, our students will be able to acquire the necessary knowledge before they enter the clinical years. In clinical years, our partners within the hospital authority have been extremely supportive. Many of them have already conducted online clinical teaching so that our students, even though they cannot enter hospital compounds, are still able to maintain good and regular contact with patients. So whatever strategies that we would adopt, our ultimate goal is to produce competent and compassionate doctors for the people of Hong Kong. For those of you who are interested in practicing medicine, for those of you who are courageous enough and dedicated enough, I'm sure the Hong Kong UMed MBBS program would prove to be rewarding and satisfying. Our integrated Bachelor of Nursing program puts together basic scientific knowledge together with practical learning experiences. Throughout the program, students have the opportunity to work alongside qualified nurses in hospitals. They also have the opportunity to do elective courses. There is the new enrichment course, during which students are able to do something they're interested in, for example, research or working with NGOs. In real life, nurses, of course, will work alongside with doctors and other medical healthcare professionals. To cater, to train them to be ready for this kind of real-life experience, we have the interprofessional education approach. During IPE, nursing students, pharmacy students, and medical students would be working together to learn from and learn with each other. To enhance our nursing students' practical competency, we also adopt the simulation approach to the teaching of nursing. For example, within the simulation lab, students would be working in a medical ward or an operating theatre, where they will learn how to care for patients during a medical emergency or during childbirth. There are many ways to care for people, to care for patients. For those of you who are interested in looking after people up close and personal, those of you who are interested in people's life stories, who are willing to share your time with them, listening to them, and to empathize with them, I think our Bachelor of Nursing program would be perfect for you. Within the Western medical profession, there has been a lot of interest in research into traditional Chinese medicine. Traditional Chinese medicine, of course, has attracted a lot of attention around the world in recent years. Our Bachelor of Traditional Chinese Medicine program adopts an integrated approach. Our students would have to learn traditional Chinese medicine as well as Western biomedical sciences. It is also a very practical course. In the first 5 years of the program, students would be learning alongside qualified practitioners in clinics and in hospitals. In the final year, they also have the chance to work in one of the best traditional Chinese medicine hospitals in mainland China. So for those of you who are interested in how Eastern and Western medicine can intersect and enhance each other, our Bachelor of Traditional Chinese Medicine program would be perfect for you. Our Bachelor of Biomedical Sciences program is heavily research-based. Our teachers included some of the most exciting and innovative researchers in Hong Kong and around the world. Students who are enrolled in the Bachelor of Biomedical Sciences program would have the chance to go outside Hong Kong to collaborate with researchers in other countries, to actually work in other institutions. They can also articulate with other healthcare professional programs such as diagnostic radiology, physiotherapy, veterinary medicine, and many others. The program provides students with a scientific foundation gearing towards biomedical research work. Students within the Biomedical Sciences program can also articulate into other programs. For example, within Hong Kong UMed, they can articulate with MBBS, and after they have completed their BBMS program, they can apply for entry into MBBS and then be exempted from year 1 and the enrichment program. So in effect, these students can actually obtain 2 degrees, BBMS and MBBS, within 8 years. So I think our BBMS program would be perfect for those of you who are adventurous, who are innovative, and who are thinking about a career in, for example, biotechnology, startup programs, or medical research within the university. Some of the most exciting advances in modern medicine concern new drug development. And because of the wide range of medications available, pharmacists and pharmacologists are playing increasingly important role in the delivery of care. For those of you who are interested in developing new drugs, who are interested in exploring new ways of community care in pharmacy, our program would allow you a wide range of learning opportunities. For example, you can work in our hospital clinics, you can go abroad to work in overseas pharmacies, you can participate in research in pharmacology and pharmacy in, for example, industry. Within the hospital authority in Hong Kong, one of the most exciting things that we are looking forward to is the introduction of clinical pharmacists. Clinical pharmacists are graduates of pharmacology programs such as ours who would be working alongside doctors. They would advise doctors on how best to use drugs. They would look at the management of hospital pharmacy. Some of them would, of course, be working in the community as well. Through our interprofessional education approach, our pharmacy students would be able to learn alongside nursing and medical students. We think that this is the best way to prepare them for the actual working environment after their graduation. So for those of you who are intrigued about how drugs work, for those of you who want to develop the future new magic drugs, I think our Bachelor of Pharmacy program would be absolutely perfect for you. Our latest and very exciting program is our Bachelor of Arts and Science in Global Health and Development. It integrates a wide range of academic disciplines ranging from medicine to biomedical sciences, public health, economics, politics, and many others. This program provides students with an interdisciplinary scope of knowledge. It enables students to explore a wide range of topics. It enables students to work with and in many organizations outside Hong Kong UMed. For example, they can work with NGOs around the world. They can work with governmental agencies in other countries. They also can work with people like banks and also other charitable organizations. The BASC GHT program is perfect for those of you who are willing to explore different disciplines and to examine how they interconnect with each other. The world as it is getting increasingly complex, and we believe that it is with this interdisciplinary approach that our students can get a comprehensive and insightful understanding of what's going on around us. So I hope the above overview is helpful. For details, please join the webinars of our individual programs. In the following, my colleague Dr. Judy Chan will share with you our approach to student well-being.
I'm Julie Chen, Assistant Dean Learner Wellbeing. I'm glad to learn that you have an interest in Hong Kong UMed's programs. I'd like to take this opportunity to share with you what the Student Wellness Team does to help support our students. At Hong Kong UMed, we have a dedicated team of experienced and friendly student wellness counselors, as well as clinical psychologists, with the professional skills to help students thrive and to reach their individual potential as a person. Through developing and maintaining growth mindset and appropriate skills, we hope that students may build on their strengths and overcome challenges. We recognize that students in our faculty may have some unique needs that are different from the general university student body, and as such, we take a personalized approach to complement the services that Hong Kong U provides. When things are difficult and feelings of stress, anxiety, or just uncertainty emerge, such as during times of transition, like starting a new program or entering a new semester, or during academic studies, such as during exams, or even in personal life, our students are welcome to come to talk to us at any time. Our wellness counselors will listen and work with students in a way that will suit his or her individual needs. This service is completely confidential, just like a doctor-patient relationship. Best of all, although they're based here at the Hong Kong UMed Sassoon Road campus, our counselors are accessible through a variety of contact methods, whichever is most comfortable for our students. Face-to-face meetings, in an office or library, coffee shop or garden, through phone calls, online communications like WhatsApp or Zoom, and even anonymous informal support through Telegram. Just as importantly, we encourage our students to come and see us if they're interested in learning how to enhance their own strengths, develop better study skills, or if they just want to talk. Our counselors have expertise using various psychological and cognitive tools and are keen to offer coaching, though of course they're just as happy to chat. Our team can usually be seen around campus looking to meet students in common areas. They'll join student society activities, they may pop into classes in person or online, they'll hold various events and workshops to bring awareness to mental health, and most importantly, they'll offer opportunities for students to develop well-being skills, such as relationship maintenance and resilience building. Our teachers are also here to support students as academic advisors through regular meetings to provide advice and guidance on academic development, career planning, and any difficulties you may have. The wellness team and teachers at Hong Kong UMed will accompany our students on this educational journey together. We're all united with the common goal of wanting to see our students flourish here at Hong Kong UMed. I look forward to developing a trusting and comfortable partnership with those of you who will join us here next year.